myself Arthi, Assistant Professor in ES College of Nursing. Today I will present my e-content. So my topic name is rheumatic disease. Rheumatic disease, it is one of the group A beta hemolytic streptococcus. If people having the rheumatic fever, if not taking proper treatment for the rheumatic fever, it will affect the major organ in our body, especially our tonsil and pharyngeal area, and affecting the heart, joints, and the central nervous system, and skin and subcutaneous tissues. It is 40 to 60% of patients with acute respiratory tract failure will go on to the development of rheumatic disease. If people having any tonsillitis infection already, tonsillitis infection, it is one of the group A beta hemolytic streptococcus infection. If not taking proper treatment for tonsillitis infection and upper respiratory tract infection, and laterly it will be converted to the and affect the heart. In heart, develop on the rheumatic heart disease. So this is the introduction for rheumatic heart disease. Next we will move on to the definition of rheumatic heart disease. It is mainly damage of the heart muscles and walls of the heart. So rheumatic heart disease, it is the infection and inflammation of the heart muscles and also affect the heart walls as a result of rheumatic fever characterized by inflammation of the myocardium, scarring and malfunctions of the heart part. So rheumatic heart disease means it is mainly affects the walls of the heart, especially in the mitral wall, and also affect the muscles of the heart. So it leads to your heart not maintaining the contraction and relaxation functions, and also vascular regurgitation will be arising on the heart, especially the aortic regurgitation will be happening in the heart due to damage of the walls and also damage of the heart muscle. This is one of the important reason for patients having the aortic regurgitations will be happen. Next is the incidence of rheumatic heart disease. The rheumatic fever is principally a disease of childhood. So rheumatic heart disease, it is mainly affected in the low socio-economic peoples and also old age people and children. This is the most important people are prone to developing the rheumatic heart disease, and the median age of 10 years, although it is also occur in the adult in 20% of cases. So most of in 10 to 15 years children was more affected in the rheumatic heart disease because of children are having the developing immune system. So this is the reason for rheumatic heart disease, it's mainly affect the children. So next is the rheumatic fever occur in the equal number of in males and females, but the prognosis is worse from the female than for males. Rheumatic heart disease and also mainly affected rheumatic fever. It is affected in both men and women, but the prognosis, it is mainly presents over the men's than female than males. The disease is seen the more commonly in the poor socioeconomic status from the society, living dumb and overcrowded people or overcrowded places. So it is already was, it is one of the group A beta hemolytic streptococcus. So low socioeconomic people and overcrowded area, the infection it is spread to one person to another persons. Next is the risk factors for rheumatic heart disease. So already was it is the beta hemolytic streptococcus. It is one of the important causative organism and bacteria name for developing rheumatic heart disease. And next is the rheumatic fever. If previously people having the rheumatic fever means if not taking the proper medicine for rheumatic fever, later it will be converted to the rheumatic heart disease. And next is the socioeconomic status. Already was said in incidence. So low socioeconomic people and overcrowded area places, the infection will be spread to one person to another person. Next is the age. So age already was discussed in the incidence. So 5 to 15 years people are more risk for getting a rheumatic heart disease. Next is the rainy season and cold climate. It is important seasonal time for developing rheumatic heart disease, and also patients having the U or I, so upper U or I, so upper respiratory tract infection, people also chance to getting the rheumatic heart disease. And next is the history of rheumatic fever, and next is the genetic predisposition. So these are all the risk factors for rheumatic heart disease. Next we'll move on to pathophysiology of rheumatic heart disease. So due to etiological factors. So already we also discussed in various risk factors. So overcrowded area and low socioeconomic status people, and important causative organism name, it is the group A beta hemolytic streptococcus, and the persons having the upper respiratory tract infection or tonsillitis or sinusitis. So this rheumatic fever, so these are all the caused by group A beta hemolytic streptococcus. So if people having the group A beta hemolytic streptococcus, it leads to untreated strep throat. If a patient is having the group A beta hemolytic streptococcus, the particular person is having the irritable throat, it leads to rheumatic fever. Next is the, if people having the rheumatic fever, the bacteria travel to the blood circulation, it will be totally affect the layers of the hearts and walls of the hearts. Once the layers and walls of the heart it is infected, it leads to the vegetation formation. Vegetation formation means abnormal masses growing on the walls. Abnormal masses growing on the mitral walls. So if abnormal masses growing on the wall means the wall is unable to open and close it properly, it leads to the valvular regurgitations and stenosis formations around the walls. So this is the important one. So once a valvular regurgitation and stenosis formations of the heart means the heart unable to maintain the proper contraction and relaxation, it is totally altered the cardiac output, it leads to heart failure. So this is the pathophysiology of rheumatic heart disease. Next we'll move on to clinical manifestation of rheumatic heart disease. So according to the it is divided into two minor features and major features, as minor manifestation and major manifestation. So major manifestation of John's, based off on the John's criteria, it will be categorized the patient signs and symptoms. So first is the carditis, so carditis and arthritis and chorea and erythema marginatum and subcutaneous nodule. So see, this is the carditis, so infection and inflammation of the heart muscles, and next is the this is the erythema marginatum and this is the chorea. So these are all the John's criteria to divide the patient signs and symptoms. And next is the minor manifestation. So minor manifestation means the patients having the fever and weakness, malaise, weight loss and anorexia and arthralgia. It means it is a joint pain. Patients unable to walk it properly. So this is the minor manifestation. And next we will move on to diagnostic evaluation. So in diagnostic evaluation, first of all, you should be collect the history collection for the patient. So past medical history of patients having any upper respiratory tract infection, or patients having any tonsillitis, or patients having any ear infection, especially in the otitis media, or patients having any history of sinusitis problem, or patients having any rheumatic fever. So yeah, this is one of the important these are all the important reason for persons are getting rheumatic heart disease. So you should be collect these are all the history for the patient. So this is the important risk factors for developing rheumatic heart disease. If next you should be collect the patients having the fever, how many days patients having the fever, and also you should be collect the patients having arthralgia. You should ask you are having any joint pain, and also you should be see the in systematic examination. Next you should be check the inspection, especially in the physical examination. You should be do the in physical inspection method. You should be see the patient body. If already was said in clinical features, the patients having the erythema marginatum, we should be see the patients having any erythema marginatum, skin rashes around the body or not. Next you should be check the patient heart rate, patients having the tachycardia or not. Next, the modified John criteria revised in the year of 1922 provide guidelines for the diagnosis for the rheumatic fever. So next we'll move on to other investigation. So elevated, if do the blood investigation, the elevated ESR count will be there. And next is the ECG and echocardiogram. So in ECG, the prolonged PR or wave or intervallitis presence. It indicates patients having the structural abnormalities of the heart, and echocardiogram and also will do for the patient. And next is the chest X-ray. It show the enlargement of the heart. And next is the positive throat culture. If take the any throat culture sample, it reflect the patients having the positive streptococcal infection. And next is the chest X-ray. Already was said, in chest X-ray you should be see the patients having the abnormalities of heart, especially in the enlargement of that cardiomegaly means and the enlargement of the heart and pulmonary congestions and other findings concerns with the heart failure may be seen in the chest radiography. Next we'll move on to medical management of rheumatic disease. So continuous taking medication of prophylaxis antibiotics, it is help to prevent the recurrent GABSH infections. And next is the patients with rheumatic fever with the carditis and valve disease should receive the antibiotic for at least 10 years or until age of 40 years. And next is alternative drug recommended by the American Heart Association for these patients include orally clindamycin 20 mg per kg in children and 60 mg in adult, and orally azithromycin or galacthromycin in 50 mg per kg in children and 500 mg in adult. This recommendation it is given by the American Heart Association. Next we'll move on to surgical management of rheumatic disease. So mainly we'll do the commissurectomy. So commissurectomy surgery, it is mainly done for the mitral valve. It is help to improve the blood circulation of the heart. Next other surgical management, it is the mitral valvectomy and percutaneous balloon valvoplasty. So mitral valvectomy, it is otherwise known as percutaneous balloon valvoplasty. So this procedure, it is help to improve the blood circulation of the heart. So the cardiologist catheter inserted to the groin to vein to groin region. So it help to improve the blood circulation of the heart. And next is the other surgical management is the mitral valve replacements. If to remove the already was it, so once if people having the rheumatic disease means it totally changes in the heart functions because of it affect the walls and layer of the heart. So especially in the mitral valve, if a vegetation formations over the mitral valve means the wall is unable to close unable to open and close it properly. So this is a reason for the doctor will be remove the affected mitral valve and the artificial valve will be replaced over the heart. Okay. So these are all the surgical management. And see the picture, this is the mitral valvectomy and balloon valvoplasty. Already I was it is help to improve the blood circulation of the heart. Next we'll move on to nursing management of the patient after doing any surgery for the patient, and to assess the patient condition and check the patient body temperature, administer IV fluid for the patients and provide comfortable position and provide O2 administration for the patients, and also check any hemorrhage over the surgery sites. And also important thing, it is continuous monitoring the patient cardiac status. If any alteration in the heart rate, immediately you should be inform the concerned physician. Okay, so these are all the nursing management. So important nursing diagnosis, it is a pain related to inflammatory response in the joints. And next is the some intervention for the pain to assess the level of pain, duration, intensity and frequency of the pain, complete blood complete bed rest and provide comfortable position for the patients and provide diversional therapy and psychological support and administer analgesic as needed. If in case of patients having any breathing difficulty, immediately we should be administer the O2 for the patients. Okay, that's all about rheumatic disease. Thank you all.